Hi, everybody. My name's Rona Ryan, and I'm here with Sharon Economides, and we're here to talk about patient experience. Sharon, tell me about your background.
Yeah, thanks for having me. Appreciate your time and being here with Innovacer. So my background actually started out at the bedside as a clinician, licensed midwife, and lactation consultant. So I worked in maternal child health for 15 years, caring for families and across that whole journey of the childbearing year. And then got into healthcare improvement and the Lean Six Sigma body of certifications. I really got excited about supporting healthcare teams in innovation and problem solving, and that's where it started out all the way through the master black belt level. So really driving improvements using data, using information, going to teams to really understand and support them with problem solving skills, and using that information to transform healthcare and really see the outcomes change, whether it be from quality or safety or also patient experience. And most recently, I've moved into the patient experience world. So I work at Kaiser Permanente now as an experience leader at one of the Northern California medical centers. And I support the hospital leadership team and clinical teams to understand from patient experience survey data, what are we doing well, what are our areas of opportunity, both from a quantitative perspective, so multiple choice responses on post-encounter surveys, but also from the voice of our patients and members, those qualitative, verbatim, open comments, those narrative stories about their experience.
Wow, extensive background. I'm excited to learn more and hear, but I'm curious, like what gets you excited with the things that you've worked on? Is there something that really stands out and you're really passionate about diving into?
Yeah, thanks for asking that. I love innovation and human-centered design, so going through Stanford's D-School program really gave me those skills of how do we center with empathy when we're thinking about solving problems. How do we have conversations with our end users, so patients in this context, to understand what are their pain points so that we're solving the right problems and not just thinking as the experts inside an organization about what we think the problems are or what we feel the problems are, but understanding those perspectives with empathy from our end users and starting with that to then prototype and pilot, ideate, and really come up with solutions and test and see, does what we came up with actually solve the problem and the pain points, those friction points that our consumers are telling us are the challenge. And tying that in with problem solving, Lean Six Sigma methodology, and also innovation going forward with learning, not just learning in the classical sense of knowledge being passed down from somebody to somebody else, but learning by including our beneficiaries, our stakeholders, our community to solve problems and transform healthcare.
That's really great, and I love the idea of bringing design thinking into that. How we process information, you know, it's our left side, it's our right side of the brain, and the different areas there. It's super interesting, especially in healthcare. It's hard, right? You might be getting positive news, bad news, and you're reacting in the moment. I'm curious, you kind of went through a lot of the story prototyping. Is there something you're most proud of that really made a difference, and been really excited that you were able to deliver and make an impact? Is there something that really stands out to you?
Yeah, actually, when I lived on the East Coast, one of the improvement projects I worked on that really changed how I think about healthcare improvement efforts involved inviting a patient in to serve on our project panel. So in the room with clinicians, with physicians, with nurses, with healthcare administrators, and having a patient invited in to be at the table with an equal voice for decision making was really impactful. As healthcare experts, our idea was we were going to be updating this 40-page handout with lots of information for new patients. And in empowering that patient to speak up, she said, actually, after I gave birth, I just threw that in the recycling. I didn't have the time to read it. I was exhausted. I was a new parent with a new baby, getting up in the middle of the night. I want digital first information. I want it emailed throughout the pregnancy in small sound bites with links that I can click on for videos and ways to find out information as it's applicable, and be prepared ahead of time for the birth experience, not just have all of this written information dumped on me when I'm already exhausted and just want to keep this newborn alive. And that really changed my perspective on healthcare improvement. Again, where as healthcare experts, we may try to solve a problem one way, but if we invite patients into the room, or at least their perspectives, as we hear them from patient experience feedback, we'll have much more meaningful insights and improvement.
Oh yeah, that experience that you heard from your patient and that advisory board, that's really interesting. I can, even for myself and a lot of folks of post-surgical care, and you come home from surgery and they give you all the instructions on a piece of paper, and then they're crumpled in the backseat of your car, and then you're like, what do I need at that moment? So definitely understand there's a lot of situations when you don't have that information at the point that you have. And it's really interesting. How do you think about the patient experience, right? It's really moving beyond just the four walls about what is that experience, when I show up for my appointment, I show up for my inpatient stay, but really thinking about that patient experience across the continuum of care. What kind of experiences, how are you thinking about patient experience in a different way?
Yeah, I appreciate you asking it that way, because the Barrel Institute, which defines patient experience, talks about that it's the patient perceptions across the continuum of care. So it's all of those patient interactions that shape their experience of healthcare. And one thing that I would like to shift about that definition is the Barrel Institute says patient perceptions across the continuum of care. And I would love to shift that and reframe it to be patient perspectives, because perception implies that somebody could be misperceiving something, versus perspective really honors that that person's experience is their truth. We can be in the same room, in the same experience, and have different perspectives of what happened. And that's what empathy is, really understanding and centering somebody's lived experience as their truth. And in healthcare, we have, until this point, mostly defined patient experience with post-encounter surveys. So surveys that are administered like hospital CAPS after an inpatient stay, and patients receive that, and that's the standardized CMS HCAPS questions about 48 hours after discharge via email or by mail. And there's other, there's CAPS, there's OAS CAPS, all of these post-encounter surveys. And the future of patient experience is looking at real time, now during this experience, what insights can we have to impact the patient while they're with us? And even beyond that, how can we more proactively anticipate before somebody accesses care, or when they're choosing their health plan, for instance? What are their individualized needs? How can we personalize their care ahead of time before they even reach out to us? Or how can we reach out to them to meet their needs more proactively and kind of shift some of that activation in the therapeutic relationship to have more participatory healthcare?
That's really great, and especially from a care perspective, right? It kind of leads into, you want the patient to take the action, and you want that person to take that action timely. And so continuing what you're hearing about of how can we be proactive with patients, how can we present the right information to them at the right time, that's really great to hear, because that's where it gets hard. Everyone wants to take better care of themselves, but how do you make it easier for the patient? And that's really great to hear about.
Yeah, making it easy.
I know you're doing your doctorate. Tell me more about that, and how is that kind of influencing your approach to patient experience?
Yeah, so I'm in the Doctorate in Education program through Northeastern University, and just got my IRB approval this summer and started the first cycle of research. And the problem of practice that I'm focusing on is, how is it that healthcare leaders learn to make sense out of patient experience narrative feedback, so that qualitative data, And what do they do with those insights to inform their decision making in healthcare systems? And one of the insights that really came from the research that I did was that most healthcare leaders learn those skills on the job. They have formal training in how to understand statistics and data dashboards that are quantitative in nature, but healthcare leaders are not trained on how to understand thematic insights on open, unstructured data or verbatim comment data, things like Google reviews or HCAHPS comments, these experience stories. How do we make sense of that at scale while still honoring somebody's lived experience on an individual basis, but on a thematic level, so that as a healthcare organization, we can make informed decisions about what matters most to our community. Otherwise, again, we're going to be solving problems that we may feel internally in healthcare, but that our patients aren't actually experiencing. So celebrating what we're doing well, and also having a finger on the pulse of what do we need to start solving for with our patients' insights at the forefront of that. And I have a second cycle of research that'll be starting to create a learning intervention for healthcare leaders to gain those skills, to upskill in that area, so that they can continue humanizing healthcare. And a lot of that is around what we used to call soft skills, but it's really rebranded as power skills, people skills, communication skills, durable skills, the art of listening, active reflection, and those skills being used not just with patients in clinical settings, but also as healthcare leaders going out to speak with patients and gather those insights and support their teams within healthcare organizations to drive improvement that's centered around patients, which is what the mission of most healthcare organizations is.
Yeah, absolutely. And love what you're saying. Well, we've got data. How can we look at it in a broader aspect at scale? How can we celebrate and then learn and figure out what actions do we need to take? And so, that means we need to be collaborating across teams. We need to be socializing that information across teams. What best practices have you learned about what works well? Collaborating and sharing that information, and where have leaders and teams gotten it wrong in past?
Yeah. So one of the things that's so important in terms of understanding data is like starting with the quantitative data, getting a sense of trends at that point, and then seeing thematic insights from qualitative data from experiences, and then zooming in further. And is there a story that leaders can use to tell the narrative of a lived experience of a patient that really exemplifies that pain point, or, for instance, that diagnosis or that journey that a patient may be on with that specific lived condition, that can really help and invite those within the healthcare organization to engage with their own feelings of empathy and see the humanity of that experience. So it involves zooming in to specific experiences and also zooming out on a longitudinal basis to see that at scale. And if we only look at the numbers, we're missing the humanity of patient experience. If we're only looking at Net Promoter Score or likelihood to recommend or stars, then we miss the unique humanity of experiences that we need to understand as healthcare leaders too.
Absolutely. And so, we want to be gathering that qualitative data. We want to be sharing that, but we also need to be hearing about the subjective pieces. How are you thinking about sharing those stories? What's that balance look like, and how are you, recommending that to the groups that you work with?
Yeah, that's a great question, and one that's organization culture specific. What's going to work? In the doctoral research interviews that I did this fall, one of the examples that these healthcare leaders I interviewed shared was on having a moment of reflection at the beginning of meetings in which stories are invited in to be shared, like a mission moment, for instance, where whatever the agenda topic is of the meeting, before diving into quantitative data and dashboards and KPIs and things like that, an example is shared from a patient experience comment, from a review, or actually inviting a patient in to a meeting to share that story. One of the organizations I used to work for on the East Coast, really impactfully, in their leadership meetings monthly, the hospital president would invite in a patient to talk about their experience. And inevitably there's not a dry eye in the room, because you're changing lives, you're saving lives, and it helps reconnect you to your sense of purpose as a healthcare leader when you hear those individual experiences, and that gets lost in the data of a KPI, for instance, at an organizational level. So zooming into that specific experience, but also zooming out to see the impact of improvement over time on dashboards and KPIs is also important, both the micro and the macro level.
Absolutely. Why you do what you do, and it's helpful for everybody that they're all making an impact, and especially if you're on the clinician side, if you're on IT, if you're administrative, everyone is doing something to support, and it's really great to, again, ground everyone that and share the positive news, right? I think we all need to be hearing more about what's working well and get excited. So that's great. Is there, next 6 months, as you're thinking about what's kind of coming up, what are the things that you're hoping to take action on and start to put in play? Is there something that you're getting really excited about as we think about 2026 coming up ahead?
Yeah, one of the things that is really interesting working in the inpatient space is that CMS added new questions to the HCAP survey, so the hospital CAP survey in 2025, and they're all around care coordination and teamwork. Mm-hmm. And there's several reports that have been published in the United States in the last 6 months about how very quickly those new questions have become key drivers of patients' overall experience in healthcare. And so it's questions like, how often did the doctors, nurses, and other hospital staff work well together to care for you? And other questions around them being informed in your care. And I think there's a lot of technology solutions that can help us work together more seamlessly, eliminate some silos in our healthcare organizations, and streamline workflows for the care team so that their experience is improved, so that they can also have that patient experience improvement. The care team's experience, there's a lot of connectivity into how patients experience their care and how the care team experience working in an organization is. And that ties back again to teamwork, and patients feel that and they know that. So I'm excited about organizing around some of those efforts and the solutions that AI and technology can offer to break down silos and break down barriers, make it easier for healthcare workers to do their jobs, so that we can best serve our patients and our community with their healthcare needs.
That's amazing. A worthy approach there. I'm curious, as we think about kind of balancing that innovation, balancing the technology, balancing what we want of our teams, how do we think about balancing kind of the innovation and that employee engagement? Is there a scale to do this right? Is there things to make sure folks don't bite off more than they can chew, and making sure that they're doing it in a manageable way? Are there recommendations that you have for organizations that are going through kind of this endeavor?
Yeah, you hit on some things related to change management principles. One of the things I learned early on in my career as a manager was, with any change, you are going to have people who are early adopters, who are excited, who are on board, who want to run with this new idea, who see the potential benefits for it. So it's so important to engage those people in the workforce to be champions of a new change. Then you're also going to have, on the other end of the spectrum, people who are the loudest detractors and who will come up with many reasons why something won't work, or who are skeptics. And I've learned early on in my career, I would often try to diminish what they were saying, but I learned there's often a lot of truth and realism to what the detractors are saying, so ensuring that they feel heard and that their concerns are considered as being valid. And how do you actually problem solve for those? they may be bringing up true risks that need to be problem solved for in order for this change to be successful. And thinking of it from the failure mode effect analysis kind of framework of what is the biggest risk, what would the impact of that risk be if it actually happened, and how do we problem solve for that and mitigate for it ahead of time in an anticipatory approach. And it's often those realists or those devil's advocates, as they often like to call themselves, who are challenging a change, who are going to best be engaged to problem solve for how do we mitigate those risks. And then you have the people in the middle who are just going to go along eventually with what happens. So the change management across the spectrum is really important to effectively roll out innovation, and also really having a finger on the pulse of the pace of change, because that can be exhausting for people in the workforce if there's constant change and they don't feel like that they've got sure footing, and that can be demoralizing. So balancing that pace and also really including people in who are going to be most impacted. In the Lean Six Sigma body of methodology, you know, they talk about going to the Gemba, to the place where the work is done. You want to include the people who are going to be most impacted by a change in problem solving and planning for it, and then you'll have the most effective change possible with whatever project or initiative that you're rolling out.
That's really great information, Sharon, and continuing to hear about, you know, bringing in patients into the process, get their feedback, and, you know, incorporating that through. Because at the end of the day, you know, you're trying to make the patient's life better, and if you're putting in too much change, well, then that's going to be a problem, and now you've swung to the other side of the spectrum, and maybe we need to be dialing it back. So really great things to be thinking about of, you know, innovation for the sake of innovation isn't always a good thing, but continuing to move the needle forward is definitely the direction we all need to be taking. This has been a wonderful conversation, Sharon. I think everyone is probably excited about hearing the detail and the amount of work you're going through with your doctorate. And maybe one final question, I think, for organizations that are trying to start or to level up their, you know, how they're thinking about empathy, thinking about their patient experience. What recommendations did you have as they're you know, thinking about getting started or advancing their program?
Yeah, I think one of the important things to think about from an enterprise scale level is, as organizations are looking at their data management plans and strategies, how are they bringing in patient experience insights so that that's at the fingertips of their leaders in the organization, and they really have a finger on the pulse of patient experience opportunities and also strengths. And so including patient experience survey data in dashboards that are at executives' fingertips is really important. And also going beyond the data that we receive to actually go out and listen would be my challenge for healthcare leaders. In whatever context they're in, how can they go out and have conversations with the people in their community that they serve, whether that's in conferences, town halls, in the grocery store, it could be formal, it could be informal. In the hospital setting, leaders going out and rounding with patients, so not just staying in their offices the whole time, but going out and hearing directly, how was your experience? Just an open-ended question, engaging in those fundamental communication skills of active listening and putting our egos aside to really understand what's most important to the people that we serve, and that will garner a rich data set that will help drive meaningful improvement in healthcare.
That's really great. Continue to listen to your patients, lean with empathy, and keep driving change. That's an awesome effort and initiative, and this has been a wonderful conversation, Sharon. Thank you so much. Really appreciate it.
Thanks for your time.
Of course.
Great to be here.